Hello, I'm Dr. Tom Utecht, System Chief Medical Officer at Community Medical Centers, and I'm here to provide you with this week's State of the COVID Crisis. As we enter what is hard to believe the 6th month of this pandemic, I know that the grief, fatigue, and stress we are all feeling can be overwhelming. And while we are starting to see a decline in the number of COVID inpatients, we recognize that this has been one of our most challenging weeks to date. Battling a disaster in the middle of a pandemic can leave many of us feeling hopeless, but I know our team still feels hope. This hope is fueled by the acts of kindness, compassion, and humanity that we see in the halls of our facilities and throughout our community every day. And although things may feel like they are changing every week, one thing remains consistent. That's the passion and dedication of our team to provide our valley with the level of care it needs to stay healthy and safe. As the pandemic evolves, our team continues to stay prepared to respond to sudden increases in COVID-positive patients or any other potential infections occurring at pandemic levels. Just this last week, we were able to repurpose space at our Community Behavioral Health Center to accommodate a surge in patients seeking mental health care. We've repurposed and converted other spaces in our facilities like endoscopy, the PICU, and some of the ORs at Community Regional back to semi-normal operations, but are continuously monitoring the situation at hand to accommodate additional ICU space as needed and will flex again as needed. We were fortunate enough to get an extension of support from the Department of Defense's team of physicians, nurses, and other clinicians that joined us back in mid-July. This was huge, but it was the last extension of the state granted, and their team will leave later this week. Our team continues to work diligently on additional solutions to augment clinical staffing over the next several months. And as we look ahead to the future, we've started work on Community's flu program. You will hear much more about this as we want to have our flu vaccination rate at the highest ever. To do this, we will be working with employee health services and all of our providers to make that happen. We certainly understand that flu and COVID could both escalate together, making this surge planning even more important. This is my opportunity to say thank you to all of the team that provide care, from the people that make the rooms clean to the doctors and nurses and other clinical staff that deliver the actual care to our patients. These 6 months have been a tremendous challenge. I wish I could say that I see a light on the horizon, but the light I do see on our horizon is how we work together to deliver superb patient care in the most difficulty of circumstances. So my thanks to everybody. For more information, please visit our website at communitymedical.org/coronavirus.